I'm always on the lookout for the next game changer in skincare. Hello, I'm Sandra Gumansingh, and today I'm diving into a hot topic, Botox and fillers. What's the latest? Who really needs them? Are they just about turning back the clock, or is there more to the story? And what about the downsides no one talks about? I've got a ton of burning questions, so I tracked down Dr. Shawn Cabell to spill the tea. Trust me, you'll want to hear this. Thank you for taking the time out to talk to us today about Botox.
Okay, you're welcome.
Dr. Cabell, tell us a little bit about yourself.
I'm a dentist. I work here in St. Thomas. I also work on St. Croix, and I have a practice in Indianapolis, Indiana. I'm a dentist, but I also do facial aesthetics. I've been involved with facial aesthetics for over 6-7 years, and I've worked in training dentists to inject. We do the treatments in the office. I do personalized training.
What is Botox?
Botox is actually the brand name of what's called botulinum toxin. And botulinum toxin is a protein that's produced by a bacteria that happens to have a very, very strong effect on our muscles and our nerves. So the amount of botulinum toxin, which is the protein that's produced by the bacteria, is so small that it can prevent a large muscle from moving. So in essence, we don't like to say that it paralyzes the muscle, but it will prevent the muscle from moving. So in essence, it's like a very, very small paralysis of a small part of your muscle. So the benefit of that is that a lot of the movements of our face cause wrinkles and lines. So if you can prevent the movement of a particular muscle, then you won't see those lines or wrinkles. Botox is the most popular brand in the world. It's very young. I mean, it's roughly a little bit more than 20 years old. So it was first FDA approved in 2002. So prior to 2002, there was no Botox on the market. It didn't exist. And then afterwards, the original use of Botox, botulinum toxin, was actually to help treat people that had problems with their eyes. So it was an eye muscle to help people that had strabismus, which is when one of your eyes kind of drifts to one side or the other because the muscles are pulling too much on one side. It was injected in the muscles so that the eyes could line up a little bit. It was discovered that it also prevents a lot of lines and wrinkles, and so then it became really popular as a cosmetic, a non-surgical cosmetic treatment. So it's the #1 non-surgical cosmetic treatment in the world. And since 2002, it's been approved and used all over the world. It has a lot of therapeutic uses. So in dentistry, we use Botox to help with people that have temporomandibular disorders, TMD, TMJ. And it helps with clenching and grinding. It helps with headaches. It can help with excessive sweating. So it has lots and lots of uses.
Right. Who can get it and who is it for? I mean, is it just older people that are getting the sagging, that are, what if a young person comes in and you don't think that they would need it? You know, what do you recommend at that point?
Well, because Botox is a medicine, it works for anyone. So if there's a need for it, it can be applied. There are lots of very young people, children, for example, children that have certain disorders where their muscles are moving too much for whatever reason, that it's injected to help so that they can get some type of relief with that. I had a patient as young as, I think she was 11 or 12 years old, and she had a slight paralysis on part of her face. So we injected to balance out the muscles on her face so that she wouldn't have as much of a change on one side than the other. In the realm of beauty, it's popular now for young women, young men as well, in their late teens and 20s to want to do this as a preventative measure, and there's really nothing wrong with that. I mean, it works just as well for those type of things as well, but I think that it's good for if there's a medical need for it, #1, as far as when you're thinking about age, and then secondly, if you're noticing an excessive contraction of a muscle. For example, I haven't had Botox in a while. I'm past my 3-month, 4-month due time. So I can make these long, deep expressions. So if I make a mean face, I can see the lines here. There's lots of people in their 20s that when they do this, they have a very mean and angry look. So by relaxing these muscles in this area, you can kind of look a little more refreshed. Makes you look younger, makes you look more relaxed. So there's really no age limit.
Well, we know a lot of people are also getting fillers, and so it's not to confuse the two.
Correct, yeah. And they're two completely different things. Fillers, which people commonly call filler, is most of them are hyaluronic acid fillers, and it's in essence a sugar gel, and the gel is injected under your skin to fill out the spaces if there's a void or if you're trying to smooth out a line. So it works completely different than Botox or botulinum toxin. What Botox does is it prevents the muscles from moving. So if the muscles don't move, you don't see the lines. So Botox doesn't fill anything. You can't make your cheeks or lips bigger with Botox. And I know that people, mistakenly think, okay, I'm injecting Botox in my lip, but what it's doing is it's preventing the muscles from contracting around your lips, which makes your lips appear to maybe look more full. So Botox does not fill anything. Botox is more so just for relaxing muscles, and filler, which is completely different, will fill, and filler is something that's in the space under your skin, and it will be there for several months, maybe possibly several years.
Well, we know you're talking about, I guess the term is atrophy, right? So it's so strange to hear that you're trying to kill a muscle, because we're always trying to build up.
So it's not
muscles.
killing the muscle. No, it's a little extreme. Yes. Well, so atrophy is pretty much when you're not using a muscle, and you don't have as much of a strong function. Think about it like this. If you have a bodybuilder, and the bodybuilder is working out, and they're working out, 3-4 times a week, and so their muscles are big, and if they stop for several years, then the muscles will become a little bit smaller because you're not working those muscles. And that's what the Botox is doing. When you have these strong muscles, and now you're not contracting the muscles because you can't contract the muscles can get a little smaller. This is something that we think about a lot when injecting the jaw muscles, because having very strong, we call it hyperactive muscles in your jaws, can cause the problems with bruxism, can cause the clenching, can cause the grinding. And if you can get a little bit of the atrophy in the muscle around your jaw, then it can make your jaw smaller. And there's lots of people that inject in this area just for that reason. And then it can also reduce some of the symptoms from having a hyperactive muscle, from having the muscle contract too much. So it doesn't kill anything. Okay. And that's an important note, because there's a little bit of misconception also because it's called botulinum toxin. And so that sounds scary, botulinum toxin, is it toxic? And the original or the real bacteria does cause a problem. It causes botulism. That's where this comes from. It comes from the same bacteria that can cause botulism, which is a bacteria or a disease that's caused from, it's a food poisoning type of thing. But the amount of the Botox that we use is so small, you don't even really use a whole bottle for one person for trying to relax the muscles. So in essence, the amount of Botox that you're using when you're doing an injection is super safe. I think that it's probably one of the safest treatments that you can do.
So let's talk about some of the disadvantages, right? I know one of the disadvantages is it's very expensive.
That's probably the biggest disadvantage. And I feel a certain way about that because it's expensive in the United States. And I think that part of that is, it has lots of things to do. We could spend a long time talking about healthcare in the United States, but the actual vial, the medicine, is expensive for the doctors to buy as well. In other parts of the world, it's a fraction of the cost, and so it's not as expensive in other places. And for that reason, a lot of people, not just for Botox, but for surgeries and things like that, dentistry, people do travel for these type of things because it's not as expensive in other places. So yes, that is a disadvantage. Probably treatment-wise, the biggest disadvantages that I see are treatment that is done either too much or too little. And just recently in the news, Simone Biles, who the gymnast, as everyone knows from the Olympics, of course, and she went and made a video. She was talking about why she will never do Botox again. And part of it was because she was saying that it made the muscles in her face move in a strange way. And this could have been because maybe there was an insufficient amount that was injected in a certain area to prevent those muscles from moving. So when I'm talking about this to say that it needs to be injected in a proper way, proper location, proper amounts to give the effect that works for you. Every person is different. So it's not 20 units here for everybody, although in general this does seem to work out. You know, there's certain amounts and numbers of units that seem to work for most people, but everyone's face and everyone's muscles are completely different. The fact that it has to be repeated, so the treatment lasts between 3 and 4 months, and there's other products that work a little bit longer, maybe 2 or 3 more months longer, but it's a treatment that has to be repeated.
Where are all the places on the face that could be injected?
So there's a few areas that are most popular. The first area that was approved, that was FDA approved for cosmetic treatment alone, was this area. So that's part of the reason why that area is most popular. We call this area the glabella area. So there's a series of muscles in this area that when injected prevent what some people call the 11 or the frown lines that people most commonly want treated. The forehead is also a common area, around the sides of the eyes to prevent crow's feet. Those are the most popular areas. It's also injected in the jaw muscles, which are the masseter muscles. It can be injected in the muscles in your chin, the mentalis muscle, to prevent kind of a crinkling look on your chin. It can be injected in your neck, the lines here. This is a muscle as well, and it can relax this area so this doesn't look as tense. Right under your nose, if this muscle is injected, it can lift up your nose a little bit.
Oh wow, didn't know that.
We teach in some of the classes injecting a muscle that comes down here, and injecting in this muscle just a very, very small amount can reduce the amount that your lip lifts up. So if your lip is not as high, you don't show as much gum. So it's a treatment for a gummy smile. It can be injected in your eyelid. In your eyelid, there's a muscle that goes around, and when that muscle is injected, it opens your eyes so that your eyes open up a little bit wider. So any muscle in your face, any muscle in your mouth, you could inject the muscle under your tongue, and it would make your tongue not move as much. So that's why it's a very unique type of medicine, because it's one of the few type of medicines that you can specifically treat one area, one muscle, if you can find the muscle, if you know exactly where you're injecting. If a person needs a treatment because of headaches as well, the same injections that we're injecting to relax the muscle also have an effect to prevent headaches. Originally, it was thought that it was reducing the tension in the muscles, and that was part of the reason why people had less headaches from migraines because of the treatment with Botox. But it turns out that in the way that it affects the cells, the way that it affects to prevent the muscles from contracting, it also prevents certain signaling factors that cause pain. And so by reducing some of these pain stimuli, then the headaches are reduced.
Can you combine Botox along with something else like filler and all that? Is it dangerous?
There's really no reason that you can't do both of them at the same time, because they have two completely different mechanisms of action. But I recommend to do the Botox first so that you can kind of have a baseline for what you're working with when you move on to doing the filler. So you may decide, hey, maybe I don't need the filler so much because the effects of the Botox have helped me out so much. So yes, they can be combined.
Thanks, Doc. Don't forget to subscribe for more. See you next time.